Every year, about 1 million Americans are diagnosed with the shingles virus. 1 in 3 people will get it at some point in their lifetime. This is according to the CDC. It's a serious infection. It's prompted by the same virus that causes the chicken pox, which more than 99% of Americans who were born before 1980 have had. So if you have ever had the chicken pox, you are at risk of developing shingles as well. NBC News medical contributor Dr. Vin Gupta joins me now. Nice to see you, Dr. Gupta. So first, let's just start with what exactly is shingles? How does it show up in your body?
Yeah, absolutely, Vicki. So this, as you said in the lead up, shingles is caused by a virus. It's called the varicella zoster virus. And that's the same virus that when you're younger can cause chickenpox. And so for anybody that might have had chickenpox somewhere in their lifetime, they already have this virus in their body. It's in a latent phase. And the concern is that if you've been exposed to it already as a child and recovered, that this might reactivate and cause shingles. So it's varicella zoster virus. It can cause shingles later in life. And exactly to your point, even if you've had chickenpox, you still need the vaccine.
So it just gets activated in your body. It's not like you come in contact with someone who has shingles and then you get shingles, right? And talk to us about the symptoms.
Yeah, so if you know somebody that has shingles, and those symptoms can be from somebody that has shingles, it's usually a rash on your body, a specific part of your body. It's very painful. It can be accompanied with GI discomfort, fevers, flu-like symptoms. If you're exposed to somebody that has it, you don't develop shingles. What can happen is you can develop chickenpox, especially if you're not protected with a vaccine. And then later in life, that chickenpox, the fact that you've been exposed to chickenpox, recovered, can cause shingles down the road in that latent phase. Same type of phenomenon. If you had chickenpox as a kid, that virus can reactivate. Same thing in the adult phase. You can get chickenpox from somebody with active shingles. So
there is a vaccine. It's recommended for people, 50 and over? What if you're younger? Should you actually try to pay for it out of pocket or get it, to get it or are you just less at risk in general to get shingles if you're younger?
Well, exactly. You're less at risk. But to your point, the CDC has actually shown, Vicki, over the last 2 decades, rising rates of shingles, even those less than 50. So it's a great question. If you're 19 years of age and older, the CDC recommends to get the shingles vaccine. We think that insurance will cover it in your case if you have an immunocompromising condition. So you're on a medication that suppresses your immune system, you have a pre-existing illness. That's a question to ask your doctor. Should you get it, and will your insurance cover it? For 50 and older, insurance covers it. It's recommended for all of us, again, regardless of whether you've had chickenpox before. We should all get it. It's 2 vaccines, about 2 to 6 months apart. Really important to get it.
That's really helpful to know. Once you've gotten shingles, can you get it again if you're not vaccinated?
You can. So if you've gotten shingles once, you can get it again if you've not been vaccinated. So it's really important to still get the shingles vaccine to reduce the risk of reactivation, a second occurrence. So that the shingles vaccine reduces the chance of getting reinfected or having a repeat episode by 90%. So just because you've had chickenpox as a kid or just because you've had shingles as an adult does not mean you can't have another episode of it. Get the vaccine.
And quickly before you go, are the symptoms something that you just have to deal with and wait them out, or is there actually a treatment for it?
No, I'm so glad you mentioned this, Vicki. There is a treatment. So if you feel like you have a rash that's not going away, go talk to your doctor. There's treatment, one called acyclovir. It can actually reduce the duration of symptoms.
Good to know. Dr. Vin Gupta, thank you so much. You're watching Daily.